Good morning. Just a quick note for the interns. Unfortunately, I'm getting an error message on Instagram that we cannot broadcast until there's an update. And since I have no clue how to do that, our discussion will be over Zoom only. So unfortunately, until we figure out the Instagram update, we won't be able to live stream. And that probably includes Night's Watch for this afternoon as well. All right, so kicking off Seinfeld episode, The Letter. Any characters or any scenes you'd like to further discuss? Anything that caught your eye? Good morning.
I think one of the interesting characters was his new love interest in that episode. Just their behavior, their interactions with together, and then obviously writing the letter and just the reasons for wanting to only have fun with Barry, not liking him, spending time with his ex-girlfriend, and his friends talking and seeing his building in his house. I think she does display really some kind of personality disorder in that sense.
So, I think your observation about Jerry's girlfriend is one that reminds us of how to approach, let's just say, maybe an ambulatory care patient in psychiatry, someone who literally presents to you for help. So again, we're not recruiting. You have office hours, they come to you for help with a chief complaint that obviously you inquire about and provide medical record documentation of. Even in that very straightforward situation, I think it is very important for the clinician, especially in a psychiatric clinic, to have unconditional positive regard and always consider your patient's behavior to be completely normal until there's evidence that it is in fact not. All right, and very closely tied to what we will refer to as abnormality, behavior that is outside a culturally sanctioned norm, is the idea of a disordered behavior. So abnormal and disordered are two very different things. And in our case, psychiatry, you're not going to call something disordered unless it is abnormal. The opposite does not hold true. There are abnormal behaviors that fall outside of a culturally sanctioned norm that are not disordered. What is the differentiation there? When does an abnormal behavior evolve to a disordered behavior?
When it causes distress or causes like a change in their normal day-to-day.
Exactly right. Okay, exactly right. And usually, I mean, and I want you to be prepared to always unconditional positive regard, accept the person's behavior when they say hello to you. But within seconds, if you see that there's clinically significant distress or impairment, you know that it's disordered and therefore inherently it's abnormal, right? So when someone, let's say Jerry's girlfriend, brings up concerns about his relationship with his ex-girlfriend and really his friends, that's completely normal until it's not. All right. So from that perspective, did you observe anything that will allow us to focus on this character and say, we can talk about this behavior from or through the lens of a psychiatrist because it is both abnormal and disordered?
Initially with the letter, my first thought was just by what the content of the letter, it seemed like she was kind of desperate and she was kind of like leading him back in their life. So at first I was like, oh, like she wrote that potentially that is like abnormal, but then it seemed towards the end that it was like actually adapted from a movie. I'm like, maybe it's not, maybe she's just like quoting the movie.
Before we understood the origin of this, or Jerry found that it was actually a screenplay, or part of a screenplay. When you say desperate, I don't want to put words in your mouth. Are we thinking that this may be overly dramatic?
Yes. Can
we use the D word here? Okay. Now, I mean, what do we do in psychiatry when we have this slice of life, when we have this slice of time? In fiction, we're thinking a 30-minute situational comedy, but in real life, there's a 30-minute office visit. So, I mean, the time frames are kind of similar. And therefore, our experience as a clinician is going to be similar. We don't know a lot about Jerry's girlfriend. We're not going to know a lot about Jerry's girlfriend when she presents to us in a real clinic in real time either. So how do we make sense, or how do we actually get to that very information that, this might actually be a problem?
We probably ask her questions about prior relationships that
Yeah.
she's had. prior
Exactly what we do, right? We take a patient history, whether we call it a past psychiatric history, whether we call it a developmental history, it's a history. We don't get to write the prequel of this episode of the letter, right? So there's no such thing as the letter of crime where we can take a peek into this patient's history, unfortunately. However, I think your observation is right on, but within the half an hour that we have in discussing this within Psyfeld, we can in fact play editor and director. What would such a prequel look like if we wanted to actually say, we need more information, and we're going to end up saying you need psychiatric follow-up. We have a provisional diagnosis, etc. Because of the history you provide us, I think blank is going on, or I think the most likely answer, the single best diagnosis is blank. Give me some of your editorial skills, your production skills, and paint that history for me. What would that prequel look like?
We actually have multiple relationships that were probably they probably all ended in the same way, where they were probably as committed to her as she felt they should have been. And so just seeing that kind of repeated history from the family.
And all right, you're earning, millions now because you have a little director's cap on, and we're on a nice, studio soundstage in Hollywood. You mentioned past relationship. Draw one up for me. Where are you going with this?
Good question. I don't know if I'm thinking. I think like the details, like just the details.
Well, no, you get general details, not specific details. Anybody. Now, listen, if a psychiatrist, if a shrink is asking you, where do you think I'd like to go? Now I'm going to have you read my mind. Where would a psychiatrist go in terms of painting this scene? Where do we actually get our impression, our model of how adults should interact with each other intimately, interpersonally? Yeah. Yeah, the single best answer is always going to be early childhood experiences, right? So seeing a very young, and I'm blanking on her name. Is it Nina?
Nina.
It is Nina. Seeing Nina when she's 5 and taking a peek at what mom and dad are doing and how they interact certainly might go a long way. And in someone who is overly dramatic as an adult, mom, dad, and a 5-year-old Nina, 6-year-old Nina in the picture. Now paint the scene for me. So what I'm asking for you, Rael, here is, what is the etiology of this condition that we call histrionic personality disorder?
Disagreements between the parents.
Disagreements between the parents, so you're not going to get a nurturing family environment.
It's changing relationships.
In which way?
They're not constant, unstable relationships.
So that's going to result in unstable relationships, and that's where I think we could also fold in that clinical significance, clinically significant distress at relationships, perhaps even starting in high school. I'm idealistic. It's probably a little younger than that, but let me still be old-fashioned. Maybe in high school.
Is there the need for validation?
There you go. Give me a little bit more of that. And we are now live. So we are discussing Seinfeld's The Letter as part of the Psyfeld course here at Robert Wood. So we're picking up on the relationship Jerry is having with Nina. We've identified very dramatic behaviors in Nina and proposed that as part of our differential, which includes normal behavior, would be a condition called histrionic personality disorder. And now, where are you going with this?
I think because she's had unstable relationship with her parents or in her early childhood, maybe she feels a need to seek validation with her other relationships, including her romantic relationships.
That's exactly right. So, you know, when a 5-year-old needs to be the center of attention, it is completely normal. Right? That is part of normal childhood development. So when they bring home that finger painting and they want to make sure that with a beautiful macaroni frame, and they want to make sure that mom and dad see it, it's okay to stop what you're doing and acknowledge how beautiful that painting is, and please put it up on the refrigerator, right? That validates. And over time, that child will no longer need your validation. They will internalize that because they know that mom and dad think that of me, and they don't have to ask anymore unless something goes awry. When mom and dad, primary caregiver, don't validate, that child will continue to seek their approval, even into adulthood. And then their partner will become a displaced parental object. And that's when you could see these types of behaviors. And when those behaviors begin to constellate with others that are very consistent, very reliable, i.e. the diagnostic criteria, histrionic personality disorder might be something, the differential diagnosis for us to consider. So again, histrionics, when age appropriate, developmentally appropriate, completely normal, 5-year-old. So when you're sitting around with friends and you tell a funny joke and everybody laughs, when your 5-year-old niece or nephew overhear you, hopefully the joke wasn't rated X, and they tell a joke and they don't have one, a quick knock-knock joke where it kind of falls a little flat. You and hopefully the people around that table with you know to laugh anyway, right? And they'll laugh, probably, again, very dramatically so, to be that quote-unquote fake laugh, but you'll have validated, right? And your brother and sister will thank you, hopefully, for what you've done. When you don't do that, and when that's consistent, that same scenario now, not of a 5-year-old, but a 25-year-old, becomes a lot more awkward. And you could see how that can directly result in impaired relationships as an adult, friends, intimate partners, etc. So that's a consideration. Any other observations on Nina in The Letter? What are the characters you want to talk about this morning? Oh, by the way, before we leave Nina, I have another thought, because it was brought up before. What is your take on her plagiarizing? Is probably a little bit of a, too severe of a term, but plagiarizing a screenplay, and she actually gave it to Jerry. She sent it to Jerry as if it was her own property. Now we can get into plagiarism in terms of a learning. I don't think it's going to come up on your shelf exam. So, but you concerned here? Is this part of the whole picture, or is this something that's an outlier and probably something we could ignore?
I think the fact that she tried to play it off like her own writing was slightly concerning. If she admitted that it was from a movie, then you could kind of excuse it. But because you insist in that it was her own writing, I think there probably is some kind of element of, I don't know if it speaks to like the desperation we were talking about earlier, or kind of like a Hail Mary to get Jerry back with her. But it's unfortunately found out.
For her?
Yeah.
What might be evidence for you to determine that, this is not okay? This is probably something that should, in fact, be discussed among a circle of psychiatrists and future psychiatrists. And I can't stand the fact that none of you guys made eye contact with me when I said that. You all looked down. It's Jerry's reaction. Remember, anytime a psychiatrist gets involved in a conversation, we really should be looking for disordered behavior, clinically significant distress, in this case in Jerry, it's self or others. Jerry is unhappy. And to say that this impacts his relationship and therefore her relationship, her interpersonal functioning, I think is true. Right, so that's always got to be the bottom line. It's subjective. But we have to hear from the individual collaterals. In this case, Jerry would probably tell us this is a problem. I mean, if we fast forward this to season 9, are he and Nina in a serious relationship? Do they even consider getting married? The answer is no. This relationship goes nowhere. And if that's something that's enduring, that is an enduring pattern for Nina, it's potentially problematic. It's potentially disordered. Right? So that's always the bottom line. And we see that reaction from Jerry. Now, we laugh because this is a situational comedy, but we can pull it out. We could pull the comedic element out and look at this for what it is. This is interpersonally impaired. All right, what other characters you want to discuss today? Now we're almost 20 minutes into our discussion. We have another 5 minutes left. Any other characters here? Kramer. Observations?
I won't say as far as he had like TBI, but he had some kind of significant brain injury
What happened?
or like head injury that he was I guess he was at the baseball game and he got hit in the head with a baseball.
Yeah.
So I guess following that, he was hospitalized and he was having some, I guess, residual effects from that head injury. It seems like he was a little bit confused. From potential also like memory deficits. He was calling his friends very important things like that.
Yeah. So I think right off the bat, there'd be some concern, depending on how many episodes Larry David decides to write this in, of chronic traumatic encephalopathy. We often think about that through repetitive insults through sports like football, boxing. But a one and done can also do it, right? So whether we call it CTE or whether we call it dementia or major neurocognitive disorder due to, in this case, traumatic brain injury, will really have to do with the course. Is it slow and progressive or is it waxing and waning? But nonetheless, we're thinking cognitive deficits. So abnormalities in the cognitive part of the mental status examination as a result of, in this case, TBI. Yeah. What are the criteria for the disorder formerly known as dementia, currently published in the DSM-5 as major neurocognitive disorder?
The deficit in terms of like either the MoCA or the universal.
Yeah, the both the MoCA probably, more sensitive, and the mini mental can support the clinical diagnosis, but this is a clinical diagnosis with published criteria in the DSM, right? And what I'll do is I'll post them on Instagram later today. And I think more importantly for our discussion, or more important for our discussion this morning, is how to differentiate those cognitive deficits from the ones that would define delirium or encephalopathy, right, which is going to be our primary differential, right? And there we're talking about the course. So there's certainly significant overlap with etiologies. And of course, part of the pun, we see an overlapping of symptoms because of the cognitive realm being impaired. However, for delirium, we have abrupt onset with a waxing and waning course, where that is not the case for dementia, right? Slow and progressive. Well, it could be rapidly progressive, but it's progressive. Right? And TBI, again, could certainly cause both, right? Trauma for both delirium as well as dementia. Any other final thoughts on Kramer?
I guess the ending I thought was pretty funny. I couldn't tell. I don't really watch Seinfeld, so I couldn't really tell if this was him.
You didn't have to tell me that.
But I like don't really know his character that well, so I couldn't tell if he was, kind of playing around, messing around with the couple that bought his portrait, or if that was actually a result of his like brain injury, and he was Actually, that
A little bit of both.
Yeah.
So,
Yeah, we might have some pre-existing factors, interpersonal or personal factors, patient-centered factors in play there that might predispose to this. But there might be a precipitant too, in those two sets of factors, of course, coming together. And we know that because of prior episodes where Kramer's behavior might certainly hallmark these types of behaviors. He's odd and he's eccentric, and his eccentricities do lend to clinically significant distress and impairment at times, both for himself and others as well. So I'm not sure we can attribute all to the TBI.
Mhm.
No. No. Again, the TBI may be a precipitant for the specific behaviors that we see in this episode, but there's enough that pre-exists, i.e. prior episodes, that suggest that there was something there, pre-existing condition. And that's probably in the cluster A personality category. Mhm. Any other characters you'd like to discuss today? Nothing else? No. All right, we'll leave it here. For those following at home, give us a couple of minutes. We will jump back onto the other Zoom link for table rounds. Otherwise, we'll sign off at this time.